the insurance landscape transformed. Welcome to XactInsure's May-June 2025 Industry Wrap-Up, your deep dive into the biggest shifts shaping American healthcare this summer. From sweeping coverage losses to landmark legislative wins, this is the healthcare crossroads moment agents and clients alike need to understand. Let's get into it. We begin with a sobering reality. 10.9 million Americans are projected to lose coverage due to provisions in the newly passed federal reconciliation bill, nicknamed the One Big Beautiful Bill. These aren't just numbers. That's 1.7 million people in California, 990,000 in Florida, 920,000 in New York, and over 750,000 in Texas. Why the drop? The combination of Medicaid eligibility tightening, reduced premium tax credits, and ACA enrollment limits is creating a perfect storm. Out-of-pocket maximums are now set to rise 15%, reaching $10,600 for individuals and $21,200 for families. For middle-class households, this translates into annual premium hikes of $387 to nearly $3,000 depending on plan type and income. But it's not all gloom. There are breakthrough victories worth celebrating. Let's talk Medicare. In a major shift, the Medicare Hearing Aid Coverage Act, H.R. 500, is gaining bipartisan traction, with 22 co-sponsors pushing to end the long-standing exclusion of hearing aids. This bill, set to take effect in 2026, mandates coverage not just for the devices themselves, but for exams and follow-ups. For millions of seniors, especially those living on fixed incomes, this is a game changer. Also new for 2025, Medicare Advantage plans must now actively inform members of unused hearing benefits, improve provider networks, and increase transparency around benefit usage. Dental reform swept across 8 states, including Iowa, Washington, and Arizona. What's changed? States like Iowa passed rules requiring prior authorization protections, clearer appeal procedures, and safeguards around overpayment recovery. Washington banned same-day denial of procedures and added fraud protections. Arizona is mandating independent medical review before denials can be made. This signals a broader state-level movement to defend patient rights, and agents must stay current on regional variations. Vision insurance? Mixed bag. BCBS FF Vision added lens fitting benefits with capped copays, while FedVip kept premiums stable. But challenges remain, especially around coverage denials and specialty lenses. Meanwhile, artificial intelligence is becoming a major force in healthcare decisions, and regulators are watching closely. California's SB 1120 and Maryland's HB 820 both lay the groundwork for strict AI oversight. Human review is now mandatory before any care is denied or modified, and transparency reports will shine a light on whether AI tools are making or breaking coverage decisions. This is vital, because unchecked AI in claims processing can lead to denials based on incomplete or biased data. Agents should prepare now by documenting prior authorization issues and reviewing client complaints, especially in high-volume practices. Let's not forget the human side of all this. May's severe storms in Kentucky and Maryland triggered emergency insurance protocols. In affected counties, insurers granted premium grace periods, waived equipment replacement delays, and offered extended refill options for prescriptions. This shows the industry can and must adapt quickly in crisis. So where does this leave us? Here's your XactInsure action plan. In the next 30 days, review clients' out-of-pocket limits and plan structure. Screen for hearing aid needs and eligibility. Flag any dental plan changes by state. In the next 60 days, prepare for Medicare Advantage comparison season. Evaluate supplemental vision and dental options. Start conversations around AI and appeals. In the next 90 days, build resilience plans with emergency savings and provider networks. Advocate for reform at the state level. Lock in ACA coverage before tax credit expiration. At XactInsure, we're not just reporting on change, we're helping you respond to it. Whether it's fighting for client appeals, explaining AI regulation, or preparing for the 2026 Medicare rollout, we're here to make healthcare clearer, smarter, and more human. For deeper support, connect with a licensed advisor or download our May-June resource kit from XactInsure.net. This has been your Summer 2025 Healthcare Policy Briefing. XactInsure, your health protected with a smile.